Liver is the one of the vital organ in our body. It is doing number of functions: metabolism, protein synthesis, controlling the bleeding diathesis, etc. We all know alcohol, it will cause the liver problem, but hepatitis B and C virus, these are deadly viruses. There are many viruses which will affect the liver. We will call it as hepatitis A virus, B, C, D, E, etc. But as already I have mentioned, two viruses are deadly virus, namely hepatitis B virus and hepatitis C virus. Why we are calling it as a deadly virus? These viruses will stay in our body throughout our lifetime if you are not getting proper treatment, and it will cause permanent liver damage, liver cirrhosis and liver cancer. It will affect at any age. As I already mentioned, hepatitis B virus spreading, the mode of spread, one is the contaminated needle and another is the blood and blood product usage, third is the unsafe sex. I mentioned about that we all have to use the disposable syringe or needle whenever we are going to some injection or therapeutic procedure. The same way, we should not get blood and blood product from the substandard blood banks. Nowadays, most of the blood banks are using the screening modality for hepatitis B, hepatitis C and HIV infection. If the screening test shows the presence of virus, immediately they are discarding the blood and blood products. But unfortunately, if the screening test, sometimes if it miss or we are using the screening kit, a substandard screening kit or the expired screening kit, there is a possibility of we can miss that virus. Then if we are getting that kind of not properly screened virus, the blood and blood product, that will cause the hepatitis B infection or C infection or HIV infection to us. So we have to be very careful to choose the blood and blood product from the very good blood bank. Unsafe sex. So whenever we are seeing one member in the family hepatitis B or hepatitis C virus, I will always recommend all the family members has to go for the screening test for hepatitis B and hepatitis C virus. The reason, even though it is only transmitted through the blood and blood product and the unsafe sex, we are seeing some of the family members, whole the family, not only the husband or wife, their kids, and it is positive in brother, sister, etc. In practice, we are seeing some of the family, all the members as coming for the treatment for this kind of the virus. Even though the virus is whatever we are telling that mode of spread, unsafe sex and the blood and blood product, how is it possible? All the family members are coming to us with a positivity. That means sharing the razor, toothbrush and even comb. There is a possibility the virus can spread from one person to other person. That's why if one member in the family comes as a positive, we have to screen all the family members for this kind of a virus. Fortunately, if there is no virus in the family members, better to get hepatitis B vaccination immediately. The public, usually the newly married couples, usually they will come and ask if one of the member is a positive with this hepatitis B virus, what about the chance of spreading the virus to their offsprings? If mother has the hepatitis B virus positive, there is a chance of spread of the virus from mother to child at the time of delivery. So, if mother is positive, immediately after birth, the child has to get vaccination. The good thing is, most of the gynecologist and obstetrician, they will screen the mother whenever they are coming for the first visit during the time of pregnancy, hepatitis B virus screening, C virus screening, as well as the HIV screening. In case if it is positive, they are advising for the vaccination, immediate vaccination after the delivery of the baby.